Okay, guys, I think we'll get started. It's a really small group tonight, so we'll be certainly open for questions and more of a discussion than a presentation for everybody. We put this presentation together basically to go over performance horses and when and how we should be evaluating them rather than just treating them by fire. Should we be intervening earlier? So I just wanted to take a minute to introduce a few guests this evening. Sheila with Vet Rocket, which is our newest x-ray machine she brought to us and helped train our staff on today. So it's this neat little unit over in the corner, and the images are absolutely amazing. And what's more amazing is that we can take this into the field without any power. Everything is cordless and go on a battery. So we actually had a horse break a leg in the middle of the arena. We could go radiograph it rather than having to move it before. So we're really excited about adding that to our practice. So hopefully you'll only see it for good routine things. And then Dr. Megan Williams is here from Michigan State University, spending a few days with us. She's just completing a surgery residency at Michigan State, a Kansas native. Actually, her and Sheila are both from Kansas, so we're heavy in the, what do you call a Kansas person?
Kansan.
A Kansan, not a Kansanian or anything. Okay. So welcome, you guys. Glad you could be here with us tonight. We usually have a little bit bigger crew, but we're thankful that we have a nice group and everybody gets something to eat and able to enjoy themselves. So we're just going to talk a little bit about performance horse evaluations, and I'm not focusing on any one sport, but certainly there are many in this town, everything from your Western pleasure and dressage and jumpers to our barrel racers, who seem to be well represented here this evening. So I chose my pictures well, so that's good. Just kind of an illustration of three different types of horses, obviously a jumper, a reiner, and in the corner there, back here, is actually a bucking horse. So we see all sorts and all kinds, and certainly our approaches to them are a little bit different, but they all have the same parts. They come with their own set of problems, but they all have the same parts. So I always think it's amazing to think about where horses came from, so I just wanted to touch on this first. Why can horses run so fast, and what type of new problems is this presented over the years? And it's always amazing to me that the Eohippus, which is the original equine species millions and millions of years ago, was so small, and over time the lower limbs elongated and then their tendons got longer. So when we look at a horse, this is the Eohippus when they started. This is the difference in size from where they were then and where they are now. And a lot of the changes came into elongation of the distal limbs and of their tendinous structures, which makes them move faster. So if you were to think of a horse in analogous to us, we call their knee in the front, their carpus, their knee, but it's actually our wrist. So the bottom from their cannon bone down to their foot is our hand, kind of fused together. So because that, and then in the hind leg, their hock, the point of their hock is actually our heel, and then their foot is all fused together. And because of that and the way that the tendons have developed, they can move a lot faster and be a much better athlete than you and I can. So, and that's just a demonstration of where they were originally when they were three-toed and as they came over the time. And this is where we are right now. So this would be their hock, cannon bone, pastern, and coffin bone down there. This isn't the best picture. I used to have one we had in the clinic. Every once in a while, we will get horses born with an extra foot. So we call them polydactyls. So if you look at this horse right here, there's actually a foot hanging off the back of his fetlock. We've had a couple in the practice of those over the years. The most recent was probably 4 or 5 years ago. And we were able to, it wasn't weight bearing, so we were able to remove it, and that horse went on to do just fine. So it's pretty neat. So when you're going out and you're going to your shows, just kind of the last thing you're probably thinking about is what you need to be doing to keep your horse sound. You're focused, you're excited about your event, you make sure your entry fees are paid, your stalls are set up, you've got all the feed you need. Maybe you are thinking a little bit about, God, did I pack some butte just in case? But you know, most of the time, you need to be focused on what you're going to do to perform and make your horse the best athlete that it is. So this is what we think about, right? So I try not to, but I still see this when I watch horses perform. You know, we see what's on the inside, and we see how horses move and the stresses that are put on their joints and their tendons and how they're performing. So we want them performing at their best. So I think the most important thing that a lot of people forget about is your horse and you are a team, but you need support, right? So sometimes that support is friends and parents and family that help you down the road. But the other part of this team is your team of professionals. Your farrier, your veterinarian, whether you have a chiropractor that works on your horse. You need to keep those channels open and have open communication. If one doesn't talk to the other, then we can miss some pretty big things that can help your horse. And I don't know how often that I've worked on a horse and then I'll walk through and the groom will say, "What'd you do?" "Well, we just, medicated that horse's hind legs, injected its hocks, or did whatever because we had just worked up the lameness." And they're like, "Oh, well, thank God. He has been so stiff in the morning for the past 6 months." And I think, really? Why didn't we all talk about this? So, I really encourage you guys, whether you deal with a groom or just your farriers, that everybody needs to communicate. And a lot of times, in a lameness situation, your farrier is going to be the first one to complain. You might be thinking, "Gosh, they're not working as well as they once did." But your farrier says, "You know what, this horse has never fought me shoeing a hind leg before, and all of a sudden they're fighting me." So then we need to look at that and say, is there a problem here? Certainly it can be mental, but often there may be a problem with musculoskeletal pain that's causing those horses to act up. Same thing with performance. Gosh, they've been running really, really well, and now we're 3/10 behind where we ever were, or they're just not making it through the event as well as they had in the past. Something's likely wrong. So the goal of this program is to just try and develop a relationship between everybody so there's open channels of communication. It goes back to working with multiple veterinarians. You might be out of town and you had somebody else do something for you. If you don't tell me what that person did or what they saw when they saw your animal, I'm probably not going to be as good of a service to you once I see it, because things change in that amount of time. And so open lines of communication are so important with caring for your animal. So what is it and why do we do it? The bottom line is, again, to try and establish that relationship as we work with our team, but also to try and have early intervention before you have a problem. So I think where I got started with this was early in practice. I'd get a lot of calls for, "I just want my horse's hocks injected. I just want my horse's hocks injected. That's all I want. I want my horse's hocks injected." So these are just a couple of things that I had discovered, and I could go on and on about things that I've discovered when they just wanted their horse's hocks injected and they knew that's what they needed. The first one is a cervical vertebral malformation and stenosis, where the spinal cord was actually compromised. As we watched the horse and examined it, as we always do before we medicate anything, we noticed that the horse had a low-grade neurologic disease. And it got a little bit more severe, actually, when I tried to flex the horse and it about fell over the other side. And this was a horse that was jumping. It just wasn't jumping as well as it had at one time. And so what ended up happening is this horse ended up having a cervical basket put in to stabilize that neck. So if I had just injected its hocks and had gone on to the next show, not quite knowing where its legs were because it had cord compression of its spinal cord, that the outcome could have been disastrous. So same thing over on this right side, and this is a little hard to appreciate, but this little thing right here is a suspensory branch. Okay, so your horse's suspensory ligament runs down the back of the leg, and then it goes into two, goes around and kind of slings the fetlock, allows it to kind of drop and hold everything together. So if you look right here, you see this nice white fiber and then this black hole right there. So that's a hole in the suspensory branch. Horse was performing well. It was fine, but obviously there was a problem. And so again, had I just medicated those hocks and gone on with the program, This tear right here, which healed and did fine, might have become very, very severe. So I encourage my clients to get their horses looked at, and depending on the situation, it might be once a year, it might be twice a year. Not every other month or anything, but almost like a mini pre-purchase. So we're looking at these horses through the eyes of how are they moving, how are they feeling, what are you doing with them, how are they performing, and then going through and stressing joints, palpating tendons, everything to try and find problems. So where does it start? So you and your horse and your veterinarian. If you're in a barn where you have a trainer, I think that's often helpful too, because they've been on the ground and they've been watching you and they've been coaching you, and they might see some things from a different side that might help us in these situations. So where does it start? So, we'd sit down and we'd talk about what you do with your horse. We may already know that because we may have known you for many years and help take care of your animal. But you'd address with us, what are you feeding them? How often do you work them? When's the last time we had any blood work done? Do you have any problems? Are they still working as well as they once did? Or is there something that's starting to pop up its ugly head that maybe we need to address? So it's, again, getting to those open lines of communication so we can help you kind of forge through some problems. Hopefully not problems. Hopefully they'll be good. So it starts with that consult and a physical exam. Part of the physical exam is looking at the animal and seeing where they're at nutritionally. Sometimes they're too thin. Obviously, this might be a little bit enhanced, this picture, but this horse is a little too fat. And just like you and I, if you get a little bit more weight on you than you're used to, your knee might start to hurt. It might be a little tougher to get around, and we feel it, right? I mean, you know when it's there. And sometimes as a horse owner, it's difficult to see your own animal because we want to love them and hug them and feed them cookies and grain. And sometimes it's difficult for us to realize, wow, they've gotten really fat. But I have shown up on calls, again, I think this horse isn't performing well, we need to do a lameness evaluation and find out what the problem is. And I walk around the corner and I think, well, I know what the problem is. And before we go spending dollars and money on injecting joints and trying to give them medication to make them feel better, sometimes going back to the very basics of let's get them fit, because right now they're not fit to do their job, and it's hard, and they will get hurt if they're out there trying to work, whether they're overweight. And if on the other extreme, if the animal is too thin, they're not going to do the best that they can do either, because they're going to run out of energy stores. So that's one of the things that you can start with, is just getting an evaluation of how the animal looks and what we're doing nutritionally, and is it working or is it not working. So conformational evaluation as well. There are plenty of conformationally imperfect animals in the world that have been very, very, very successful. This is one of them, Kentucky Derby winner Real Quiet, who they said they cringed with years ago because he was so crooked-legged that now he was going to be a very popular stallion because he had won the Kentucky Derby. So there's plenty of them out there that have done very, very well. But we can look over and see, are there some things that we can do to add them a little bit extra support? So simple things, are they have a foot imbalance? Are they pigeon-toed? Do they turn out? Do they have what we call a valgus deformity, where their limbs turn out? Those horses are more likely to interfere and hit the inside of their fetlocks. So then we can go ahead and talk about what we would put on their legs for protection and support. Long backs, is there something we need to address differently? Or short backs with your saddle and your fit and the pad and everything that it goes that way. And again, you guys are going to need to tell us a little bit too of what we're experiencing on that horse, but we can look at all of these situations and see if there are things that we can help with to make them more successful. So we go through, this is a picture of an ultrasound, but first thing is, after the physical exam is palpation. We go through and just take a feel of everything on those horses. So we're going to start at the head. And, I would say we'd even start before then. Take a look in their mouths. go through, palpate their poll. Do they have any pain back through their neck? We're finding more and more horses now that actually have some lower cervical vertebrae problems. And it's a very interesting lameness, because it's not like they're a sore neck and they can't put their head down. Sometimes they get that bad. But these horses often will have what we call a bridle lameness. So you'll be riding, but it's very, very obvious in the dressage world where they really put them on the bit. And horse will lunge fine, it will flex fine, it'll move fine. And you go to collect that horse and shoulder in, and all of a sudden you've got this awful forelimb lameness. And it's not coming from the limb, it's coming from that compression of the cervical cord, or cervical facets, excuse me, in the neck there. So that's just these little vertebral bodies that articulate there. So we'll go through and palpate those, and we'll do the cookie test where we ask the horse to flex both ways. The gaiter test, which is when we pick the horse's foot up. A horse that, you know, is hurting in its neck might not go down and sniff its foot. But if you guys have ever stretched your horses, what do? They put their head down and wondering what you're doing with their leg there. And so if they don't, then that can be a sign that there may be some pain going on in that neck. They like this part of the exam because they get a cookie. So then we're their friend. So then we're going to go ahead and kind of just slide our hands over the horse. If we don't touch him, then we don't really know, right? So we feel what we call the apaxial muscles of the back. So we palpate alongside of the spine on each side, just with kind of a gentle pressure, all the way back from the withers all the way back to the tail through the gluteal muscles, and see if we have any reaction. Now, I always go back to these tests because I'll do them first, but it's interesting how sometimes the horses will be quite goosey, and then I go and I lunge them for a few minutes and I go back and they're like, I don't care, that doesn't bother me anymore. So sometimes they're just reactive. We always compare one side to another as well. If they're just as reactive on both sides, sure, they can have sore muscles on both sides, but it may be that that horse just isn't really excited about being touched as well. So we have to put it all together and evaluate them that way. So we've felt on both sides of the back, and then we're going to also feel straight down the middle. So horses have what's called a dorsal spinous process. So the vertebrae is down here, and then up from it they've got these little spines that sit there. And so we've got a lot of ligamentous tissue over the top of it, but we can kind of palpate back through there and see if there's any pain directly over their back as well. There's a phenomenon called kissing spines, where the vertebrae are going this way for a while, and then they start to go the other way, and they've got an anticlinal vertebrae that's kind of straight up. And sometimes it's touching the other one, and that can cause a chronic lameness in horses, a chronic pain situation called kissing spines. And then back through the gluteal muscles. So feel the butt, right? Does it hurt? And if you're feeling the butt and it hurts, most commonly when I see that, if I feel them sore on the right, when I go back through their bum, which leg's sore? Left, right. So I take a really close look at the left when they're sore on the right. And sometimes it could just be that there are muscles sore on that side, but often because of compensatory movement, they may be more sore on that opposite side. And we see that a lot in horses, and that's one of the things with kind of regular evaluations we want to try to avoid is compensatory lameness, right? They go lame in the leg that was the good leg because they learned how to take care of themselves and spare the other leg. And over time that catches up to them. So the strap muscles of the rump, those are the muscles that go right down alongside behind, on either side of the tail. And that is a common area for Western working horses to get hurt, where they advance that leg and stretch those muscles, and sometimes we'll get something called a fibrotic myopathy, or it can be from trauma too, if they got poked with something, and that'll scar. And if anybody's ever seen horses where they walk like this and they slap their leg down, because those rubber bands don't give like they used to, and now they just slap down. So going through there, the other thing is we want to go and actually palpate in dressage horses right inside, so you're feeling their stifles are right inside their butt between their hind legs, are the adductor muscles that bring their legs forward, and it's a very common injury in dressage horses where they'll tear that. And sometimes we'll go back and find those horses where it's healed really well over the years, but they still have this bump there. But it makes them really lame. They get really lame, and all of a sudden their leg goes, gets huge because they've had this huge muscle tear. But again, we've gained familiarity if we go over these horses on a regular basis. We know that that lump was there 2 years ago, and that lump is there now, so it doesn't really bother me as much that it's there. If I've never seen the animal before and it comes to me the first time, I'm going to wonder, how old it is. So as we go through and we palpate the forelimb, we're going to kind of start at the top, go down through the shoulder, the biceps brachii, which are the muscular tendus, I guess, structures below the shoulder and in the front. Sometimes you'll get something called bicipital bursitis, where they get inflammation in that bursa that brings that limb forward and cause them to be quite painful. The elbow, which is not a really common place for lameness in horses, but it does happen. The antebrachium is right below the elbow, so the forearm basically. Go down and palpate through there, see if anything's sore. Again, not a super common place for injuries. Other than lacerations and wounds when they run into something with their forearm, but not a real lameness issue problem. The carpus, again, that's the horse's front knee, right? That's the big mobile joint, which is our wrist. And it's made up of multiple little rows of kind of square-shaped bones. And it's very, obviously, takes up a lot of stress because they totally flex when they're running, right? And when they land, they hyperextend. So we can have injuries from that as well. So when we do that, we're going to feel, is there any effusion? Is there swelling? Is there any pain? Is there flexion reaction? Again, going back to, well, I know this horse has always had this little bit of fluid here. And I radiographed it 2 years ago. I know what it looked like 2 years ago. Now, if it raises its ugly head, then we can go back and compare what we had 2 years ago to what we have today. The splints, which are two little bones on that original picture we saw, are two little bones that run down the inside and the outside of the cannon bone. Usually not a huge problem, except for a few mares that maybe kick or got kicked. Which was it? Yes. Who is perfectly fine today, right? But they can fracture them from kicking, or they are very small bones, so they can be reacted that way. You'll hear of horses popping splints, right? That's just a little ligamentous attachment where it'll pull apart, and then it becomes just a little bit of a cosmetic defect, not a big deal down the road. The digital tendon sheath. So the tendon sheath is right on the back of the limb. Very common to see athletes have a little extra fluid in those sheaths. On the fetlock, about a fist above and a fist below, there's this little encompassed sheath with fluid, and it has a job. It has a job to allow basically some extra fluid to lubricate those tendons that run over the back of the fetlock and up and down. So sometimes horses will get what we call tenosynovitis. If it's non-painful, if it's just effusive, it's non-painful, we flex them, it doesn't bother them, we don't get really excited about it. If they start to show a little bit of reaction where they have some flexion pain, then that would certainly necessitate us to look a little bit closer with an ultrasound and evaluate and see what's going on in there. And then the pastern is those little bones. There's two of them. Well, P1, P2, and then P3 is within the hoof capsule. So that's the coffin bone. So the pastern would be P1, P2. That's where we see ring bone. If you guys have heard about ring bone, that's just arthritis in the pastern joints. High ring bone would be between P1 and P2. Low ring bone would be in the coffin joint, P2, P3. So, and then the hoof. We're going to go through and take a look at what's on their feet. Are they balanced? Are they wearing their toe to the outside or the inside? Or is there something that should be a red flag for us of what's going on in their foot and in the way that they're traveling? So a podiatry consult would be just meeting with your farrier. We feel very strongly that every horse could really benefit from having just 2 x-rays of their foot every year. And I say 2 because the forelimbs are usually more of a problem than the hind limbs. Sometimes we might look at the hind limbs and say, wow, we don't have any heel back there, or something looks a little funny, we might need to do them too. And this is just a picture of Dr. Lamb taking a peek at some films. And we work very closely, we try to work closely with your farriers to try and help them. Because as much as they've got landmarks on the outside of that foot, they'll be the first to admit to you that they can't see what's on the inside. So most farriers really appreciate if you can take a film of each foot once a year, just to kind of give a little bit of a blueprint check. Do we have enough sole depth? If you don't have enough sole depth, those horses are more likely to bruise. If they're more likely to bruise, they're more likely to abscess. And you're more likely to blame the shoer. So they like them to be looked at as well, and provide that for them to help you. And maybe try to avoid some problems. We've seen some really nice normal looking hoof capsules that end up with heels that are just slammed in the ground and underrun. So hind limb evaluation, it's basically the same thing, a separate group of joints and muscles, but we're going to go down through and take a palpation of the horse's hip, down through their trochanteric bursa, which would be, you may have heard a term called whorlbone. Whorlbone is a term for trochanteric bursitis. There's a large muscle group. Actually, this is pretty good evidence of it. There's a large muscle group, as you can see, lots of large muscle groups that hook up here in the hip, and where those muscles roll over, there's fluid in between this little protuberance in the femur, or the big bone there, and they can actually get some pain in that bursa that causes them some problems. So we'll start there, go down through the stifle. Does anybody know what the stifle, what joint would that be in our body? You can't answer. Your knee, right, yep. So our knee is a horse's stifle. It's a scary joint. They've got a lot of muscles that stabilize it, but you've got 3 bones, 14 ligaments, 2 menisci. There's a lot of things that can be wrong in there. We can see bones on an x-ray, and we can see a lot of the soft tissues on an ultrasound, but it's a really complex joint. So we're thankful that they've got all these muscles to help stabilize it. And it can be a problem, but it's something, again, to keep an eye on. Sometimes it's easy for you guys to feel fluid on a knee, in a fetlock, big wind puffs. Stifles are a little tough. You know, we might reach over there and go, holy tamale, there's a lot of effusion. You're like, what? What bump is that? Because it's not as dramatic to look at or to feel, and it hides often kind of underneath the horse. So sometimes you don't feel that. As we slide down past the stifle, on the back of the horse's leg is the gastrocnemius. That is our Achilles tendon. So it goes down and it hooks on that point of the hock. Horses can get sore in there. It's not huge common, but it happens. They can actually rupture that tendon, which is a really, really remarkable catastrophic injury, but they can get through it. Usually that would happen if a horse slipped and hyperextended and tore that, but they walk like a cat when they come in. It's very frightening. It's one of the scariest things I think I've ever seen. And I wasn't very far out of school when I saw it for the first time, so then I was really scared. There was a stud horse from Pahrump. We weren't even in this clinic yet, and he walked off the trailer and his hock hit the ground. And it was just amazing. We didn't have a hospital, so we did everything we could to stabilize him, and then we talked to them about managing him at home and keeping him up on a cable, and they did. And about, I think 6 months later, maybe 8 months or a year later, I had heard they were standing him at stud, and I thought, there is no way, right? And I called him, I said, how is he doing? They're like, oh, he's fantastic. They said, we just started loping him. I'm thinking, oh my God, really? If you ever see a horse's hock hit the ground, it's one of the scariest things you'll probably ever see. So, okay, going on. We're gonna go down and feel the hock. So some changes we can see in the tarsus or the hock, which would be our heel. Some you can't, as far as with your naked eyes on the outside. So if you've got a big boggy hock, that's fluid in that hock joint. Okay, so when you see that fluid, it means that there's something going on. Whenever we see extra fluid on a joint, something happened. Might have not been now, might have been down the road and the joint capsule kind of got distended, but it stayed a little bit boggy. But that upper joint is the big mobile one that moves in the hock, like the horse moves, right? It flexes like that. It's not as common of a place for a problem, but certainly can blow up and be an issue as well. The joints that you all hear about are the two lower joints in the hock, and those ones just shear when your horse moves, right? If your horse is a barrel horse and it stops and it turns, those little rectangular bones just kind of do this. They don't move a bunch, they just move a little bit. And that can certainly cause horses to get some pain when they're in a turn. They might not be lame. They might move just fine. But all of a sudden, instead of digging their hind end in the ground and coming around a turn, they do this, pop, pop, pop. Or they get in halfway and then they blow out the backside. Or if it's a dressage horse, they just might not be as willing to collect and move forward as well as they once did. If it's a jumping horse, they might not be switching their leads. They might be sticky. So there's a lot of different things. Sometimes you can palpate arthritis in a hock. If there's a lot on the medial side, you'll see this big bump on the inside of their leg. But not always, and that's where your radiographs come in handy. So then we're going to run down through those flexor tendons, the same things that are in the front leg. So you've got your superficial digital flexor, your deep digital flexor, suspensory ligament. Just take a good feel and see if we feel anything that's thickened or different than normal or normal how it was last time. Take a feel of the pastern, see if we feel any arthritic changes. Take a look at the hoof angle and footwear. So if I see a horse come in that I'm looking at and I see the toe all dubbed off, and I don't feel like it was done that intentionally, then I know that horse is dragging its feet. So they don't want to elevate their leg. If they don't want to elevate their leg, I start to get concerned about upper limb lameness, something like a stifle, because that's responsible for elevating the limb. And if they don't elevate, they drag their toes and they wear their toe off. Same type of thing if I see a horse that's got, you're looking at their foot and it's got a big old toe flare on the outside, then I know they're really landing hard on the inside and trying to roll out, and I look a little bit closer at their hocks. It's not always right on, I could be wrong, but it always gives me a little bit of a red flag to take a peek at. So we always try and look at them in all their gaits. So we're going to walk them, because sometimes I can see horses move with a little swivel in their limb. That's something a little bit different. Stifle lamenesses sometimes will show us more lameness at a walk and a canter or a lope than they would at a trot. So everything manifests itself a little bit different. But we're going to go through and watch them at a walk. And I wrote there, preferably watch them come out of their stall. I don't really like to look at horses that have already worked that day, because I can get a lot of information of those first few steps out of the stall. And if not, if you've hauled them in or that, you can tell me, you know what, he's always stiff coming out of a stall. That tells me something's bothering him. Now it's just our job to be detective and find out what it is that bothers them. So we'll look at them at a trot and then a canter or a lope. So sometimes we can't see it until you're on the horse. And if we're in a situation at a barn where we can have you jump on, we like to look at the horses before you work them, and then when you're on them and when you're working them as well. Sometimes that's not always possible. Barrel racers are probably not just going to jump on and make a run for us. But a video is great, right? We can see what the horse is doing. And sometimes that'll just show us something that says, oh, you know, I don't like the way he's popping out of that turn. I think we should look at this. So sometimes we're going to see something on those videos, or when you ride the horse, that's going to give us a clue. Like a dressage horse, like we talked about earlier, that gets on the bit, asked to collect, and all of a sudden they've got a lameness that wasn't there before they asked him to do that. So then we need to look closely at what's happening there. Is there something in their mouth? Is there something in their throat? Is there something in their neck? It gives us a little bit of a clue. Horses often just don't turn into bad horses for no reason. If you've got a great horse that's always done fantastic and all of a sudden they're not, something's probably wrong. And that's the whole goal of this program, is to try and find it before it gets to that point. before they're slowing down, before you're not making any money anymore. There's something wrong. Let's find it. Let's fix it. And again, establishing those relationships, you kind of know what you've done over the years with the animal and what you can do to help keep them sound. So we've gone through it all, right? We've gone head to toe. So what do we get out of this whole deal? And some of the horses are going to be okay, right? They look great. There's no problem that we can find musculoskeletally. You're telling us the horse is still having an issue, then we need to kind of look further. It's not always their joints. It's not always their muscles. Can horses have respiratory problems? So they're running out of air? Certainly. Can they be having an issue systemically? Meaning, could something be going on with their liver or their kidneys or something else just making them feel pretty cruddy? Absolutely. Could they have some gastric ulcer pain that's making them feel awful? Yes. So sometimes it's a little bit of a needle in a haystack, but it's fun. Try and find their problems and address them. But again, going back to, I love to get involved before that happens, right? I love to be able to look at them before we think they're having problems. I want to know how they are when they're doing well. And that helps us to kind of establish those protocols. So if the horse is great, we're not going to go injecting joints just because you're here today and we decided that we probably should. The horse isn't painful. It doesn't have any flexion pain. Everything moves okay. Great. We've got a baseline of normal for that animal. I know that this foot's always been crooked, and we've made these adjustments to try and change. I know how much fluid was on that fetlock 2 years ago and what it is today. Others are going to need to look a little further. So back to the things like we talked about. It's not always musculoskeletal. Maybe we're going to need to scope the horse. Maybe we're going to need to run some blood work on them. Maybe we're going to need to look a little closer at, are they having some metabolic problems? Is there a reason that they're fat and you don't feel like you've changed anything on their feed? So more and more we're diagnosing horses with a metabolic syndrome, something called insulin resistance. So a little bit similar to type 2 diabetes in people, overweight individuals. And that can cause these horses to not metabolize as well. So they just stay fat. So there's some blood work we can do to try and help diagnose that, try and get their weight where we need it to be. Some of them are going to need to work up a lameness. I've had horses come in here where we've worked on one and client says, you know what, I'm going to bring you my other horse. There's nothing wrong with her. I'm winning everything on her. And they come in and, you know, they flex off 4 out of 5 lame in their knees. And they are winning everything, but they've got so much heart that they're able to do that. And so we've got to try and intervene to try and help those horses so they might last another 4 years instead of another 6 months, which they're really close with. So, but I'm not of the belief that you should just inject horses' joints every 6 months and like an oil change for your car. You don't treat a joint that doesn't have a problem. But you establish these range normals, and we know that if a horse is not performing the way it is, and we've gone over and we've done these physical exams, that maybe they do need some help in those joints. So we might do some radiographs to take a look at the bone. We might do an ultrasound to take a look at a thick and soft tissue in a lower limb. This is a picture of nuclear scintigraphy right here. This is an advanced diagnostic that sometimes we'll send horses for that maybe they have a multiple limb lameness, maybe they've had a lameness that just blocks a little funny, or we can't seem to eliminate with our diagnostic limb anesthesia. So we'll go through and get an overview. Basically, we refer you out to a center that has a nuclear camera. We inject those horses with a radioactive isotope, and then they run a big gamma camera over them to look for areas of inflammation. And that's what this is here, pictures of where there's more uptake. That looks like a fetlock there. This is a distal tibia there. So it's just showing you some areas. Magnetic resonance imaging, or MRI. So MRIs are now available, usually used mostly in the distal limb, mostly in the foot, when maybe radiographically we don't see anything on x-rays, but we want to know that the tendons and the soft tissue structures within the foot are okay, and this will help us to image those. So what are the recommendations? We come to the end of it all. You know, we're going to make some recommendations maybe on what we should do to maintain soundness. Are there some things we need to kind of keep an eye on? Monitor that swelling that's in their tendon sheath. They're not lame. They don't have a problem, but they've always had this fluid. You just need to watch it. Make sure that we're not getting more fluid in that area over time. Or is there a certain problem we should address? You know, what this horse flexed off 4 out of 5 when I bent its knee, we probably should take a look at that knee and see if there's something we need to address to help that animal, even if they're performing well at that time. So that's it in a nutshell. You know, the basically goal of this program is to try and keep your animals sound and performing at their best. IT girl. Does anybody have any questions? We can stop for a minute.
What are they currently doing for splints?
So really, splints need time, right? So sometimes people might want to hurry up, return to work. They don't usually cause a lameness issue, but if you put them right back into work, they might just stay a little bit sore, meaning sore to palpation. They probably feel it, but they don't get terribly lame on it, and it's going to make healing take a little bit longer. So if those horses have to return, our initial recommendation always is just ice and rest and anti-inflammatories. If they're having to go back to work sooner or those splints are getting really reactive, we might go 2 other ways. One would be inject the splint lesion with a little bit of a steroid to help tone down the inflammation around it, or sometimes shockwave. Shockwave helps to recruit growth factors and that into their area. So extracorporeal shockwave therapy is an electrohydraulic shock. It's not TENS, it's an electrohydraulic shock. So we have a big unit that we put on there, and it's the best explanation of how it feels. Horses tolerate it very, very well, but if you've ever had your hand ice cold and like accidentally hit it on something, that's about how it feels when you have it done. They actually use that unit to break up kidney stones in people. Lithotripsy, yeah, and that's what it is. And so they use it in plantar fasciitis in humans as well.
So how long do you rest the horse with a splint then?
Oh, depending on how large the splint is, you know, I'd like to give them a couple weeks. And again, it's going to also matter on what kind of work you're going to do with that horse too. It's a pleasure horse, it's probably not going to bother him too much at all. But if it's a barrel horse or a dressage horse, it might bother him a little bit more. Okay. So this is a neat little thing I thought everybody would appreciate.
Most of us go through life pretending that we're satisfied where we are, pretending that everything is okay, pretending that we don't have any special goals or ambitions or desires, when really deep down inside we do really want more. So if you want to do something, if you thought about something you want to do, take it head on. Decide that you're going to start looking at it, start doing research on it, start tackling it, start becoming involved in whatever and wherever it might lead you to begin to explore the possibilities in that particular thing that you're seeking, so that you can begin to learn all you can about it. Decide that you're going to face it, that whatever shortcomings you have, that you're going to strengthen yourself there. Whatever training that's required, that you're going to go get that training, that you're going to get started right now. George Washington Carver would say, do what you can, where you are with what you have, and never be satisfied. Yeah, don't get satisfied with yourself. Always know that wherever you are, you can enjoy more, that you deserve more. But most people, you know what they do? Most people go through life quietly and safely, tiptoeing to an early grave. Find out what it is you want and go after it as if your life depends on it. Why? Because it does. But what do we say? But there'll always be tomorrow. Oh no. There's no guarantees you're going to show up tomorrow. There are a lot of people who were here yesterday, that they're not here today. As you look at where you want to go, and if you look at life as a race or look at it competitively, and I think really you should be competing with yourself. If you decide to work real hard at what you do, to master that, to learn everything you can about that, what you're doing, you'll beat 50% of people in life. A person who wants to be successful in business, who expects to be a top salesperson, you don't have to tell them to do certain things, to do follow-up and follow through, to have an attention to detail. They do that automatically. That comes with the territory. And so by the same token, before you step out into the arena and you know the competition is stiff, that you do your homework, you do your research, you get more than enough information so that you will have the tools, that you have the knowledge, you have the information, and you're properly armed so that you can take on any competitors. It really doesn't matter because you have done your work. You've been thorough and you have left no rock unturned.
Inspiration for the evening.
Best way to prevent splints?
Best way to prevent splints. You know, I guess overactivity in a very young horse, because that's more common where they get it. I don't think that there's really any way to prevent splints. You know, the medial splint, the one on the inside, is more likely to have a problem than the outside because it bears more weight of the carpus. But whether they're working or just going out and bucking and playing with the torque and the pressure that's put on there, it may just happen. I don't think splint boots don't truly help you to keep from getting splints. They help you from hitting your splint with your other leg, but they don't control any change as far as drop and that.
Is it better to use a boot or like a polo hat?
So boots have a little bit more support. They will control the fetlock drop. That's the only thing we have we have control of interference and pressure, right? They help to protect the limb. And then the boot is going to help to control a little bit of the fetlock drop. Not that much, really. But we control a little bit of it with the boot. And I think it's got a little bit more than the polo does. A polo is good. It adds maybe just a little bit of support, but more of a barrier for the leg if they were to hit themselves with the other foot, or if they're stopping really hard and irritating the back of their fetlocks like a skid boot would do. A polo is going to help with that quite a bit too. So
you think those new Hydraulic class boots are better than all the other ones now? They have more support or develop?
well, I don't know that they do. I don't know that I know that for sure. You know, I think the Classic Equine and the Pro Choice have a big old suspensory strap as well. So I don't know that they're. I don't know that I believe that they're better. I don't know that they're worse, but. Yes.
Talking about Princy and her kissing spine issue, would a discipline like dressage collecting that horse more help her?
No, I think it would probably hurt her more. Yeah, I think it would hurt more because she's actually in the flex. Yeah. You know what? I don't know what happened to a few of my slides. My acupuncture slipped out. So there was a slide in here, just so you all know as well. Darn it, I don't know where it went. Dr. Boucher has recently become trained at the Chi Institute in Florida and is doing some acupuncture for our practice. So she's really excited and had some amazing results even in the first couple weeks. So she's headed back there again mid-April and again in June, right? So anybody that would like to visit with Dr. Boucher about acupuncture as far as combining it with our Western medicine as far as diagnosis and treatment of some inflammation and problems. That's available as well. And she's had, like I said, some really cool cases already. So we're really excited about adding that to our practice.
It works on the dogs too.
Yeah.
The only place around Island over there in Ann, on 95, he does acupuncture on the dogs.
Okay.
I've done dogs too. I've done a couple dogs with intervertebral disc disease, so lower back pain that's causing them to really knuckle over on their back legs. And the goal is to not necessarily fix the animal, but to help them out. And one of the dogs in particular, she had them buckled over on her paws.
Good for allergies too.
Yeah.
I messed up my slide. See, it's at the end. There it is. It got it the wrong place. Sorry I left you out, Dr. Brochet. But we're really excited to add that modality to the practice and think she's going to help a lot of horses. So, and then just a little bit, one other thing I was going to visit about that should have been in the middle as well. I'm not very good at my PowerPoints, and my 9-year-old wouldn't stay up to help me last night, so I had to do it on my own. So this is something called a lameness locator or a gait analysis system, which is relatively new, and it's a computerized system. You can actually see maybe this horse has a little bonnet on its head, and then it wears a little collar or a little collar on that pastern right there, just a little cuff, and then has a little sensor on the bum there. And it's a pretty interesting little thing. I would call it a gait analysis system and not a lameness locator. It's not going to pinpoint things, but it helps us with figuring out the lame legs. It basically evaluates the motion of the legs. Are they synchronous? Are they moving the same? Or is one moving down and up more, which would then indicate that there may be a lameness. And it will break it down to an impact lameness of when they hit, or what do they call the other lameness? Movement of some type too. So it's kind of a neat deal. You put these on these horses and then you get a computer readout of what's going on, and you can evaluate it after your blocks and that as well. So.
Hey Doc, the answer to my question, go back to Western Pleasure with him?
Oh. I think Western Pleasure would be easier on him than anything trying to round his back up and collect. I think dressage would hurt him worse.
What's the name of the saddle pad?
Oh, you had told me a pad one time before.
CSI.
Okay.
CSI is the name of the pad. And that's got that force plate in it that just helps distribute the weight a bit.
Earlier you talked about the horse slapping his foot down, and especially in the back. Now what causes that?
So that's a tear in the muscles. So like your muscles that go below your bum, or I guess it would be more like here, that allow the leg to come forward. Okay, there's a wad of scar tissue in it. And so it'd be like the rubber bands, instead of going all the way up, something jerks the leg back because there's a wad of scar tissue. So functionally it can't move as well.
The horse with the round when we were in Chicago, it had that, nobody could figure out what his problem was. It was driving everybody nuts, and he'd slap the one foot, and he was doing cross country and everything else, and every so often that would start kicking up again.
And usually it's more of a functional lameness, so it usually doesn't cause them a bunch of pain unless they tear the muscles around it. It's more of a function issue.
It was an event horse, one of the pony club horses. And they had like 2 or 3 vets, and nobody could figure out what the heck he was doing. He wasn't really lame, but it looked terrible when he had an attack, you know.
Yeah.
Do you ever look at saddle fit when you're doing, you said you looked at the horse under saddle, but sometimes the horse will operate really differently if the saddle doesn't fit right. So do you look at that at all?
Yeah, I don't always.
That's not your specialty. But.
Yeah, no, not always routinely, but absolutely, especially if I've got a horse that's sore in the back or has a lameness just when you're on their back. That's something I'm going to look really close at, you betcha. In fact, we'll often ask people to, if they didn't bring a saddle, to come back and bring their pad and saddle that they're riding with so we can see how it's fitting them. All right, guys. Well, thanks for coming tonight, everybody.
Thank you.
You bet.